You mentioned earlier that people need to start their colonoscopy at age 50. What are the reasons where somebody might need to start at age 40 or 35 or earlier?
People will start at an age younger than 50 if they have additional risk factors for developing colon cancer, and the most notable one is a family history of colon cancer. So if a person has a first-degree relative like a brother or sister or a parent, especially if that person developed colon cancer before the age of 60, then it's a good idea to start potentially at the age of 40 or even earlier if the parent or relative had colon cancer at a very young age.
Are there other people that there's a high risk? Some people that have family histories of polyps, familial adenomatous polyposis or something like that. Tell me about that.
There are some genetic syndromes for polyp formation, and because of defective genetics, potentially the colon has a tendency to develop more polyps. And when this happens, you'll see multiple family members sometimes develop polyps. You may see one or two family members who develop, thousands, hundreds of polyps that require them to have their entire colon removed. And when you see that, then in some of the additional relatives to that patient, you may start a lot earlier, potentially at the age of 15, 20, or 25.
When you look in a colon, when you do colonoscopy and you see a cancer itself, that means it probably started with a polyp and should have had that colonoscopy done earlier. What's a cancer look like?
It's a vastly different than a polyp. It's more of a mass or a growth. It's a lot larger than a polyp. It's typically circumferential, which means it goes around the wall of the colon. It may not completely circle the colon, but it may involve half of the circumference or a fair portion of it. It is typically very red, irritated. It may even have a purplish color to it, and just rubbing a tumor sometimes will cause it to bleed, so it's very fragile.
It must be something you don't want to ever see, but you see occasionally. Let's talk about if you see polyps, or if you don't see polyps, how often do you recommend somebody comes back for repeat colonoscopy?
It depends to some degree on the number of polyps they had and on the size of the polyps they had. So if they had 2 polyps or less and they were both small, we might be fairly liberal with that patient and say come back in 5 years. If they have 3 or more polyps and they're precancerous, then we may shorten the interval down to 3 years. If any polyp the patient has is greater than 10 millimeters, we might also recommend a 3-year follow-up for that patient because those features suggest a higher risk for that patient developing additional polyps in the future. If they have no polyps and they have no additional risk factors, then they may get the ultimate sentence of 10 years, which is great. So,
yeah, and that's when I had my first one at age 50, and then I had another one at 60. When do you stop? If you have one at 60 and there's no polyps, you recommend 70 and that's it, or do you recommend at 70?
It's variable from one society to another as far as the guidelines are concerned, but most societies will tell you between the age of 75 and 85 you can start thinking about stopping colonoscopy surveillance.
You know, we're living longer and longer. Are we stopping just because it looks like that person is not a polyp former, or it's just that age limits the need to do it after age 75 or so?
No, and you bring up a good point. We like to consider the patient as an individual. So if the patient is 82 and they're extremely healthy, they don't have many health problems, and they look like they're going to live to be 105, then we might still recommend that they come back at an interval that is deemed appropriate for them. So we don't stop purely based on chronological age. We certainly consider the biological profile of the patient as well.